Good morning, everyone. Oh, come on, come on. It's the last day. Good morning, everybody. And welcome to the final general session of the conference. Boy, have we had a great time here in Chicago. We've learned a lot over the past few days on ways that the Aging Network can best position ourselves to meet the needs of the nation's growing aging population, and we're not done yet. This morning, we'll start off with a dynamic discussion on how the Aging Network can best meet the needs of our nation's growing, diverse population of older adults. But before we get started, let me acknowledge our good friends at Cigna HealthSpring for their support of this session. As a leading health service company with more than 2 million Medicare and Medicaid customers across the country, Cigna HealthSpring is committed to helping our nation's Medicare and Medicaid beneficiaries live healthier, more active lives through personalized, affordable, and easy-to-use healthcare solutions. And that is right up our alley. I understand that with us this morning from Cigna HealthSpring is Dr. Johnny Gore and Carla Vigilante, Director of Community Outreach for Medicaid, who've been with us the entire conference. Please stand so we can thank you for supporting N4a in this morning's fantastic session. Now, before we get started, I have some great information to share with you. At the opening general session, you gave us the charge for N4a to be bold, right? Right, okay, be bold. And so we are. We're launching 2 new initiatives that are bold that will help the network. First initiative, we know that creating creative partnerships with healthcare is a priority for the future of this network. And to that end, N4a has established the National Community Health Alliance to work with a partner, soon to be announced, in a management services organization that will assist area agencies on aging in contracting with managed care. More information to come on this exciting initiative. And we also know that data collection is a key component of our work moving forward. So we're also launching another exciting initiative that we'll be telling you about in this session, all around data collection. So let's get started with this morning's session and all of the work that we have to do together, and especially the important work we have to do together that is the focus of this general session around ensuring that we can meet the needs of diverse elders. As this country's population of older adults grows, it is rapidly becoming diverse. From the number of older adults from minority populations expected to rise 217% in the coming decades. This increasing diversity of the aging population poses a number of new challenges as well as opportunities for this network, and also new responsibilities for the Aging Network. It's important that the Aging Network, area agencies on aging, will be culturally competent, culturally sensitive, and culturally inclusive throughout our agencies. These are important issues that today's panel is going to address through the services we provide and the staff that provide them at our agencies. We need to both be respectful and responsive to the varying beliefs and practices of the communities of older adults that we serve. And that's where we're going to talk about, that's what we're going to be talking about this morning. In response to the growing diversity of our nation's aging population, N4a's current president, the wonderful Kathy Bowles, identified diversity as an area of special attention, one that deserved special attention by this association. And as a result, she created N4a's Diversity Task Force, and that task force was created in 2017 to be able to support our members as they strive to meet the needs of a diverse aging population and to develop a workforce that reflects the people that we serve. I now want to ask Kathy to join me on stage so that she can share with you more about the work of N4A's Diversity Task Force. Kathy Bowles.
Well, good morning. See you smiling out there? All right. Who went to the Magnificent Mile yesterday? I keep asking. Raise your hand. Okay. All right. More people going home without money today. That's the way it goes. Well, good morning, everyone. I am so thrilled to be here with you all and close out this our last general session for this wonderful conference. Has not the conference been fantastic? It has been great, and we appreciate all the effort that N4A puts into bringing all the wonderful speakers and presenters to us so that we can learn and take that back to our own locations. As Sandy shared, diversity of the nation's population of older adults poses new opportunities as well as challenges to our communities for the Aging Network. As a network, we must ensure that our staff and our programs are culturally competent, increase the number of leaders and staff who reflect the diversity of the clients that we serve, and tackle health disparities. It's a big one, health disparities among older adults. During my presidency, N4A's great board of directors created a diversity task force to provide guidance and direction to N4A on issues related to cultural diversity, cultural competency, and health disparities in an aging network. The work is important, and we must do a better job of serving older adults in our communities as well. Here is a sampling of what the Diversity Committee has discussed this year. We talked about succession planning. I think that's vitally important for every one of our area agencies is to have succession planning in place. Now that this is the topic that we should all be paying attention to, our committee discussed the importance of succession planning because we know that 20 to 30% of AAA directors are looking to retire according to the most recent survey. So we need to have people in place to take over. The task force agreed that our network has an opportunity to be more inclusive going forward by encouraging a diverse leadership with succession planning. Members shared their own succession planning preparation and informal plans for transition. So that was a critical component of our discussions for the Diversity Task Force, succession planning. Next, we discussed health disparities. The National Hispanic Council on Aging, who we'll hear from in just a few moments, is, as we start our panel discussion, spoke to our committee. Sandy's brought in great panelists and experts in the field to discuss with us health disparities. And we had great discussion about the programs for diabetes, prevention, and control, as well as their Affordable Care Act navigator, immunization programs, and other educational and preventive outreach programs that they have to reduce health disparities. The Office of Minority Health spoke to our committee about their strategic initiatives to reduce health disparities as well, and to achieve high health equity. The Office of Minority Health is putting people and communities at the center of its work by enlisting the support of community-based organizations, individuals, and faith-based organizations throughout the country to help promote prevention. So health disparities. Next, we talked about cultural competency training. The Office of Minority Health also spoke to the importance of achieving national CLAS, C-L-A-S standards, which help ensure effective, equitable, and understandable and respectful quality care and services that are responsive to a diverse cultural health beliefs and practices. They also shared information on the availability of cultural health continuing education resources that accredit health professionals in cultural competency. Wonderful panel of leaders today. We have to talk about that and cultural competencies and health disparities. So I'm happy to be able to tell you that we did lots of work as a task force to address the issue of cultural disparities and competencies and all. And I'm happy to say that we did great work on it, but there's much more to do. So in meeting yesterday, we did have more conversation of how we'll move and what next steps we're going to take to continue this conversation on into the future. But today, you're going to be pleased to know that we're going to be joined by a wonderful panel of leaders from some of the country's top minority aging organizations. The panel and I are going to discuss ways we can work together to enhance cultural competency of the aging network with a round-robin question and answer, followed by audience questions. So be prepared to write your questions down. At this time, I would like to introduce the panel to you and ask that they would come on stage as I call your name. First, we have Michael Adams. Michael is the Chief Executive Officer of SAGE, which is Services and Advocacy for Gay, Lesbian, Bi, and Transgender Elders, the oldest and largest organization in the United States dedicated to transforming the LGBT aging experience. Michael Adams. Please help me welcome Michael. Welcome, Michael. Next, we have Dr. Yanara Cruz, the President and CEO of the National Hispanic Council on Aging. Dr. Cruz and the Council focus on providing the Latino perspective on public health, older adults, and caregiver issues to increase policymakers and public understanding of the needs and impact of vulnerable sectors of our society, and to encourage the adoption of programs and policies that equitably serve everyone. Please welcome Dr. Cruz. Dr. Cruz. We also have Karen Jones with us. Karen is the President and Chief Executive Officer of the National Caucus and Center on Black Aging, or better known as NCBA. And housing, they also do Housing and Management Development Corporation. During its 47-year history, NCBA has been the only national organization devoted solely to providing effective leadership in making minority participation in aging services a national issue and priority. Karen is also serving this year as the president of the, Chairman-President of the American Society on Aging. So please help me welcome Karen Jones. And finally, we have Dr. E.J. Lee, the National Director of the Senior Community Services Employment Program at the National Asian Pacific Center on Aging. She oversees their CSEP program in 7 states nationwide. Help me welcome E.J. Unfortunately, Sister Carmela Licado with the National Association of Hispanic Elderly is not able to be with us today because she's affected by the California wildfires. So let's keep her in our thoughts and prayers. I also want to note that the Diversity Task Force works closely with the National Indian Council on Aging, but unfortunately a representative from the National Indian Council on Aging was not able to join us today. So thank you so much for being here this morning to help us have this important discussion. And so now we're going to begin our discussion and speak with our panelists, our experts on this issue. Good thing they put my name here on my seat so I know where I'm supposed to sit. Well, we are so happy that all of you are here with us today. Obviously, you bring great insight and information to this organization on how we can better serve the populations that we serve in our community. So we're excited to hear your responses to the questions that I have for you today. So we're going to start with this question. What are the major challenges that the populations that you represent face as they age, and what are the mistakes that have been made in delivery of services to these populations? So let me start with you, EJ.
Okay. Hi, I'm EJ. Okay, so I'm representing Asian American and Pacific Islander group, and the most mistake and challenge we have is many people, they are thinking that we are one group. That is, I think you heard of it. We are not one group, AAPI. We are more than 50 ethnic groups, and then no two groups are speaking one language. Even Chinese people, for example, they have so many different languages. So we are very, AAPI group itself is very diverse. And then one of the mistakes we could make is we are thinking just, translate the English to their languages is simple, right? But we have to be very careful when translating those information to their ethnic languages. We also have to think about cultural translation. So some word from English version or American Western style is not applied to their understanding. So we have to, many mistakes we are making is not just language wise, we also have to think about their cultural, translation.
Okay. Mm-hmm. Great. Karen, would you like to?
Well, good morning, everybody. And I feel like we've spoken on this issue several times. If you attended last year's conference, we were there to talk about the same thing. And I'm hoping that after today, that there will be really a conscious effort on everyone to get rid of panels like this, where we are already diverse, we already respect the diversity, and we can move forward as a country. In particular with the African American community, we pretty much face the same issues that we've been facing. Health, of course, disparities and health access to good medical care, opportunities in terms of those who still want to work or those still need to work, affordable housing as a result of gentrification or just not having the rising costs and housing costs across the country, and of course racism, which still pretty much exists and crosses all of those things that I just talked about in terms of moving forward. You would think in 2018 we would begin to move ahead of those things, but those things seem to be still very prevalent, and then of course becoming worse as this climate that we're living in has created a sense of separation among us. We are all Americans, and we all should work together to make sure that this continues to be the best country in the world.
Dr. Cruz?
Thank you. And first of all, congratulations, Sandy, for a great meeting. Thank you for having us here. And thank you, Kathy, for putting together this follow-up to last year's event. So I think I'm very much building on my colleagues' previous comments. I think with regards to challenges for the Latino community, I think issues around health disparities, one of the things we are observing is that Latinos are often aging with multiple chronic illnesses. So I'm talking about diabetes, while having hypertension, possibly other chronic diseases as part of the aging process. And that's an important element to keep in mind as we develop interventions and programs for this population. Similar to African Americans, many Latinos are also lacking housing. And we are very fortunate to provide housing in some pockets of our community across the country, but clearly it's just not enough. And as many of you know, housing opportunities from the federal government at this point are very, very limited. So housing is a major issue. The other item is economic insecurity. So there's a long history of working in the service industry, for example, working in restaurants, those who are serving us here in working in construction. And so with a history of working in the service industry, folks are retiring with lack of pensions, lack of benefits that allow them to age in economic security. So, so those, I think, health inequities, economic insecurity, and housing, I would say, are the three top challenges that keep me up at night and keep many older adults very concerned as they age. With regards to lessons that have taught us what not to do, I think, as it was indicated previously, I think we are not a monolithic population. So, so I think when we develop programs and interventions for the Latino segment, I think we need to understand that there's different levels of acculturation taking place. So if the person has been in this country for generations, 3 or 4 generations, if you go to New Mexico, for example, you find families who were there forever. The border moved on them. It wasn't them moving across the border. It was actually the border that moved on them. And so, so I think understanding that there's different levels of acculturation is very important. Also understanding that there's variation in terms of the different populations. For example, Cuban Americans, if you look at studies that have been done, they tend to be more financially sound, have the educational status is higher than folks who are of Mexican American descent, for example. So understanding those differences is critical in developing interventions. And I think following up on Karen's previous comment, I think as we work with Latinos and any diverse population, I think we need to keep in mind that there's a history of discrimination that is very much alive these days. There's also a reality with an anti-immigrant sentiment, and so folks are afraid to access services. And so as we approach programs, I think we need to be very, very aware of that. So I'll stop there.
Thank you, Dr. Cruz. All right, Michael.
All right, thank you, and Kathy, it's great to be here. I appreciate the invitation, and an apology up front. I'm recovering from a cold, so hopefully my voice and coughing won't be a distraction. I would start by really reiterating and building on the comments that have been made by my fellow panelists, because LGBT older adults come from all of the communities represented here, and so many of the themes across our communities are similar. I would add an additional theme which is particularly relevant in the experiences of many LGBT older adults, and that is social isolation and invisibility. This is a major challenge for older adults that SAGE and our partner organizations work with, and it stems from a variety of factors, including the fact that LGBT older people are 4 times less likely to be parents, twice as likely to be single and living alone, and because of historical discrimination, much less likely to be connected to their families of origin, all of which leads to isolation, invisibility, thin support networks, and therefore a greater need for services, which is why I think this conversation is so important. I think this is the case for all of our communities. In fact, the need for services and supports is even greater. In terms of mistakes, I think that probably one of the key mistakes is that we sometimes can inadvertently contribute to that invisibility and isolation. There tends to be a sentiment or a concern, for example, that if we collect data, undertake efforts to determine the the presence of LGBT older adults within our networks, within our provider settings, that we're somehow invading privacy, creating discomfort, etc. I think we have to really grapple with that, because the fact is that there are LGBT older adults in every service setting in this country, in every care setting in this country. And we need to be prepared to assess the needs of this population. And so one of the key issues is to be ready to engage in LGBT inclusive data collection. And SAGE actually has published a guide on how to do that in a way that is respectful, in a way that is effective. So I think we have to be careful not to contribute to the invisibility of LGBT older adults. And I must add one more thing, and this is really reiterating points made by Karen and by Yanira, is that we unfortunately are living in a time where you could well argue that bias and discrimination is on the rise. And in particular, for the LGBT elder population, the challenges with social isolation and invisibility are exacerbated by our current political environment. And to give a very clear example of that, one of the things that SAGE was involved in on the advocacy side of the organization last year was an attempt by the Trump administration in Washington to remove LGBT older adults from the National Survey of Older Americans Act participants, which is the exact opposite of the direction we need to go in terms of data collection, and reinforces this notion and this invisibility and this social isolation. So we are living in a time where we have to really ensure that we not only that we make progress and that we not slide backwards.
Great discussion on that topic. I appreciate your insight on that. But that leads us to really this important question is, what can this aging network do to address the obstacles you just outlined, even though we have shrinking resources? I mean, and we all do, I'm sure. But what do you see as a way for the aging network to address these obstacles? And I'll start with you, Karen.
Oh.
Yeah.
Okay.
I just like to jump all over.
I see.
There's no rhyme or reason.
Well, if you notice, I'm the only one that didn't bring any notes. And so, and I guess because I've been doing this such a long time. And I guess the way that I'd like to see all of you, because you're on the front line of the people who need services the most. And the one thing I always say is you can be the leaders in humanity. I mean, if we just stop looking at people as black, white, Asian, LGBT, whatever the case may be, and just look at someone who is in need of your services, you could really begin to change, I think, the attitude of the very people who we look to fund assisting fellow Americans who may not have the resources, who obviously don't have the resources because they come through your agencies. You could be on the front lines of that. The other thing that I always encourage people to do, particularly in the jobs that we do, and anyone in the aging field particularly, is that you are the experts on what the needs are in your community. And as the experts in your community, you have to be the advocates. And if you're the advocates, that means that you don't necessarily have to be political, but you have to be the person that makes sure that the people who are making the decisions on fundings of your programs understand what the program is doing. You cannot expect people who are in elected office to know everything. And though they may tell you that in their campaign speeches, that they know everything, they don't. So if we want aging services and programs to be funded at the level where we know we can make an impact in our communities, it has to come from the experts, the people like you who see it every day to help make a change. So your job, unfortunately, goes beyond what you do in the office or what you do in the field. It's what you do to make sure that the people who are making the decisions on funding the programs that will change the way we assist people as they age has to come from you.
Thank you, Karen. EJ?
So shrinking resources is really, big issue for us at this point. But AAPI community, we have, not only the shrinking resources, but also accessibility to the existing resources is also very, challenging for us. So my suggestion to overcome this obstacle we have is I think that, absolutely your expertise in this area, aging issues, and then also you have some leadership. But, we also need to go to the community, and then AAPI community and Asian community. There are some of the community-based organizations that you could meet. So many Asian seniors, because of the language barrier or lack of accessibility, and then they don't know how to get there, so they are coming to the community-based organization, or sometimes in a bi-ethnic group, they could go to the religious organization or some groups. So they are forming some types of a group in your community. So I think in this situation with shrinking resources, I think it's really good, best way to work with communities. The groups will be the most effective way to serve our Asian community.
Thank you, EJ. Dr. Cruz?
So I think Kathy mentioned earlier the class standards that were developed by the Office of Minority Health out of the Department of Health and Human Services some years ago. I'm familiar with those standards, and I think they're very good, and they're a very good way to start to engage and activate every community that is in your space. So I think looking at those and incorporating those standards as much as possible is a good way to get started. I also think that elections are important. And I think we must get more resources to address the needs of a growing aging population in our country. So the midterms elections are less than 100 days away, and we must educate, nonpartisan, educate our clients what's at stake. And when they go out and vote, they must know who is protecting their safety net, who is protecting Medicare, who is protecting Social Security, Medicaid. And that, I think, is more important right now than ever. The older adult vote will be an important deciding factor in the upcoming elections. So I think those two items would be critical.
Michael?
And I would say, I think one of the great things about this question of what the Aging Network can do is that in many ways the Aging Network is already doing it. It's certainly when we look at efforts to increase inclusion and address the service needs of LGBT older adults, we are seeing more and more great examples of progress, even with limited resources throughout the Aging Network. Last year, SAGE put together a guide through our National Resource Center on LGBT aging that highlights many of those positive examples. And so I think the great thing is, among our colleagues here in this room, there are so many examples of how we can make progress with limited resources. And I would also, Kathy, hearken back to something that you cited earlier with reference to the class standards, and that is the notion of equitable quality care and services. Because there's the question of resources. We all struggle with limited resources. And then there is the question of how we decide to allocate the limited resources we have. And that, I think, is where equity comes into the equation. And just to share very briefly, an experience with my own organization, with SAGE. A number of years ago, we started grappling with the fact that when we looked at the direct service side of the organization, we could see through our data that our services were not reaching LGBT elders of color in the ways that they should, given the demographics of the population that we're working with. We did not necessarily have more resources to work with, but we had to really think intentionally about how do we equitably use those resources that we have to reach the full diversity of our population. And it meant making some changes in the allocation of resources and program design that we believe did not leave anybody behind, but restructured our programs in a way that made those programs more accessible to a broader cross-section of people. And so I think equity and allocation of resources is important. And I'll just close on this point by reiterating the point that Yanira made about voter education. We have been very heartened to see the important role that AARP has decided to play in the upcoming election in terms of ensuring that older Americans have the information they need to understand what's at stake in the elections, which kinds of policies are supportive of their interest, and who is supporting and opposing those policies. And I do believe it's incumbent upon each of us in our own way, and certainly actually for the very first time, SAGE is going to be participating in nonpartisan voter education this year because information is power, and the vote is power.
Well, I see we're winding down on our time, and I had so many more questions. I had questions on caregiving, and then I wanted to delve into health disparities, but we're going to end on this question, and I'm going to ask that you keep your response as brief as possible. One of the ways that n4a wants to enhance our cultural competencies throughout our aging network is promoting the hiring of aging area agency staff and directors that mirror or look like the populations that we serve. What is the one thing you would recommend that all AAAs do to promote and enhance diversity in the workforce, in our own workforce? Michael, I'll start with you.
Sure. So I would say that one thing I would recommend is to think holistically about the hiring and the experience that people then have in the workplace. And in particular, that we think about not only creating more diversity in our staff, but also ensuring that there are leadership opportunities available, leadership development opportunities available, mentoring opportunities available. In some of the conversations that SAGE has had with diversity consultants over the years, they've recounted stories about organizations that do a better job at diversifying their hiring, but then do not do a particularly good job about ensuring the success of the people they hire. So.
That's a good point. Dr. Cruz?
So I think, just building on that, I think mentorship is important, and in my experience, there's lots of diverse young professionals who are interested in the aging field. And what we need to do is give them a chance. Oftentimes they don't have lots of experience, but they quickly pick it up. And it's been my experience at the National Hispanic Council on Aging, hiring young professionals who are smart, who are eager to learn, and promote them. Give them the opportunity to have the responsibilities that come with the job, and they will deliver. So I think being intentional about the recruitment and hiring and targeting diverse populations is important. And then partnering with organizations that have a history connecting with these communities. At the local level, there's a huge network of organizations that represent all of us. And I urge you to connect with those networks at the local level and figure out ways to hire and identify individuals through that network that it's already located in your local communities.
Well, all of that. And I'll just give you another suggestion. In most communities, high schoolers are required to do some kind of community service. And they have to have that. I know in Maryland, D.C., the DMV area, they are required to have several hours of community service in order to graduate. So I would look to even allowing high school students to look at opportunities of interning in your office while getting their community service, or even if just they're interested in it, because then you build up an interest where they go and they can be educated, and you've now moved into getting more people interested in the aging field. And then when they graduate from college, we hope that they'll be willing and want to come and work in your agency. So there's a pool of people out there that we just don't take advantage of, and that's one way that, you talk about succession. Well, the only way you have succession is you got to have people coming up the ladder. So that's a way to at least look at another aspect, along with the things that Michael and Yanetta said.
Same as everything plus. Okay, so diverse workforce in AAA will be absolutely improving your capacity to serve. At the same time, you are empowering your community members through your services and program you provide. So everything we talk, looking, going to the local and then going to school and everything. But my suggestion will be community advisory board. It might be a good way for you. And then one just advice for me from when you are working with AAPI community, I think in the AAPI, as I said, is now one group, okay? In your county, in your areas, I think there is dominant group. For example, one county has a lot Vietnamese people. The other county has a lot Cambodian people. The other county has many Korean people. So you have to figure out which Asian group, specific each group you have in your area. And then you have to form this advisor board meeting with those people. And when you are serving, Korean dominant community, but you cannot have Chinese advisory board, for example. So that is a very important thing. So, you need to know your data in your area.
That's a good point. Another, using interns, college interns.
Yes.
Often we hire them once they intern at our organizations, but that's another vehicle to find good people to move into your organization. Well, we've had exciting discussion this morning. Unfortunately, we weren't able to get to all of the questions that we have. But please join me in thanking this wonderful panel for engaging with us this morning. We have time for a couple of questions, and so I think we have mic runners throughout the thing. And here's a question here.
Hi, I'm Autumn from the Area Office on Aging of Northwestern Ohio, and I appreciate this panel and the panel last year that was done as a workshop, and a voice that I think is missing in that we have a difficult time reaching in our community is the Muslim American population, and I would just have a comment that perhaps n4a can include religious groups in their cultural competency as well in future workshops and sessions. But I did have a question as well. In our area, with the Hispanic community, we have individuals that are afraid to access our services. We all know that the Older Americans Act does not, it stipulates older individuals, 60 years of age or over, not citizens. And we have local levy funds that they just have to be a resident of our county to receive those services. But could you speak to could anybody speak to individuals that are being sponsored to become citizens and not being able to access services?
Who'd like to take that question?
So,
Everybody's looking to you.
yeah. So I think, thanks for that question. And yeah, the reality is that there is a lot of fear, not just in your region, but across the country. So know that others are struggling as well. I think one effective strategy that has worked for us in delivering some of the services lately is connecting with the local communities that are known for Latinos in your region, and partnering with them in delivering your outreach messaging. I think that has worked. The local radio stations usually have a lot of trust in the community, so connect with the radio station in your area. Become friends with the producer and those working the programs and the shows in the morning, and get the information out to them. I also, caregivers. Try to target caregivers. Oftentimes, it's the caregiver who's making decisions about older adults in their family. So targeting them and educating them on their benefits, and just addressing the issue of fear, I think is important.
Was another question way back there in the back.
Hi, my name is Annalisa, and I'm with the St. Louis Area Agency on Aging. And 10 years ago, we were part of the group that formed SAGE of Metropolitan St. Louis. We recently are hearing from LGBT populations that they're scared to be out in the community. So we had a lesbian couple that was recently denied housing at a senior housing facility because they're married. I'm wondering how we can visibly make it clear that we are open and welcoming to these populations.
Michael?
Yeah, thank you for raising that, and that particular case, which is now led to a federal lawsuit against a continuing care retirement community in the city of St. Louis for denying access to same-sex couples, is, I think, both an illustration of the challenge that we face and also an opportunity as well. Obviously, the challenge is that discrimination does still exist, and we are operating in an environment in some ways where it almost feels as though discrimination is increasing, perhaps even being encouraged in certain ways, which helps to lead to situations like the one you're describing. And the couple that is suing is not the only couple, actually, that has been denied access to elder care in St. Louis. At the same time, those kinds of situations, because this couple has been courageous enough to come forward and to legally challenge the discrimination against them, is an opportunity to educate our communities and the public about what's at stake here. Because in our experience, and I believe this is the experience of our network in general, the vast majority of Americans want to see older people treated well and treated respectfully, and treated in a supportive way. And we have to believe, and we do believe, that the vast majority of Americans would think that it is wrong to turn away an elder couple that is in need of elder care simply because of who they love, in this case, because of their sexual orientation. So SAGE has actually was aware of the discrimination that was going on before the lawsuit was filed, and we intend to really shine a spotlight on the case as a way of reminding people of what is at stake here when we get into these kinds of polarized situations and these polarized approaches, and remind ourselves of the commitment that we have to each other as a community and as an aging community to take care of each other. So we hope to utilize that case and the courage of that couple to really build awareness and build education and build support for treating each other with love and respect as opposed to discriminating against each other.
Thank you, Michael. I think we have time for one more question, and eeny, meeny, I'll move over to this right here. I can't really see out there, but.
Good morning. I'm Brenda Clack from Flint, Michigan, and I proudly serve on the board that our current president, Kathy Bowles, is the administrator. My question has to do with composition of the board. Just how important is the composition of your board in your local community? And should there not be an individual or individuals who are receiving services be a major part of that board? I'm interested in what should you be looking for as you gather new board members, and our number is important also.
Okay, who would like to?
Well, I'm not sure are you talking about the boards of your particular, oh, I see, okay. Well, I don't know what your bylaws or, what they say about that, but I think it's obviously very important that your board should reflect the population that they're serving, and that the board members need to ensure that that is something that's occurring. But again, it depends on what the bylaws say in terms of someone on the board who's receiving services. That's something that has to be taken up with the board. On my particular board, which is nonprofit, certainly different from that, we don't have people on the board who are receiving services, but we have people who have backgrounds in the areas and what have you. So it is still input with some relationship to what the needs are. And so again, it would just depend. Now, I don't know what the bylaws are different, or so it just depends. And if that's an issue in your community, that's something your board should address.
I would just add to that, perhaps to expand out that focus to think of boards and other means of engaging feedback from our constituents. In our organization, we have a lot of focus, for example, on constituent advisory councils and things of that nature, which in some ways I think can be more effective than having, say, one constituent representative on the board, because it gives you a broad cross-section of voices of older adults, and that broad cross-section of perspectives can then be shared with the board. And it can be both, right, board and advisory councils.
One of the things we do, which is very useful, similar to what you're doing, Michael, is holding town halls in our communities to give our folks this space in a culturally appropriate, safe manner where they can communicate their concerns, where they can give us guidance and advice. Because I think as professionals, one of the things we have to do is step out of our comfort zone. It's very comfortable to be in DC and just not travel, but we have to step out and connect with community and hear directly from them. And creating those spaces, it's our responsibility. Communities will not, do that. But once you create the space, I assure you that folks will come in and provide advice and guidance. And that gives you a rich source of guidance and advice.
And we're talking our provider networks need to be culturally competent, our agencies, and then our board needs to look like. So it's not just one facet.
Sure.
That's what we're saying.
Yeah.
You know what, we have time for a couple more questions. Is that you, Amy?
Hello and good morning. I'm Teresa Barbara Book. I'm from Oneida, Wisconsin, and I'd like to give a shout out to the Native Americans in this room. We are, there's a variety of natives here, a variety of people who lead our tribes. And I just want to let you know that our tribes, we're not all alike either. We have our own languages, we have our own cultures, our beliefs, and we also, I guess I want to give share this, that we're not all rich from the casinos. We have very poor, it's a reality, but we have very poor reservations that people don't have housing, they don't have electricity, food. They're suffering as we speak. And I just wanted to let you know that the people who work near or around the reservation, reach out to them, because there are people in the big cities that are natives, and they, some of them might have a program that could assist them. Not always, but there are programs that they might be able to get some health assistance or dental or housing. It depends on the tribe. So I just wanted to say that we're still here and we're in the communities, and we also have that trust issue. So once you get that trust in there, please don't break it because it's very hard to get back. So just to let you know we're here, and have a great day.
Thank you.
Kathy,
Karen?
Michael, Janetta, and I, and Young is new, so because she's new to the position. But we normally are represented also by n4a with the National Indian Council on Aging. So don't feel left out. She's just not here today. But we do this stuff all the time, and we represent as many people as we can. We haven't broken it down necessarily to faith, because then we'd have 20,000 people on this stage. But I just wanted her to know that n4a is usually here on the stage with us.
Any additional questions? Raise your hand high. Here's one right here. Okay.
Thank you. I'm Marie Stein from the Alzheimer's Association, and I know we haven't had a chance to talk as much about health disparities, but I'd like to just ask the panel about dementia. The Alzheimer's Association has one of our strategic pillars as diversity, and we're realizing more and more that the issue of dementia and other health disparities are so difficult in some of these communities where it is not okay to say that you're experiencing cognitive decline. So can you help, can you address that?
Well, I just last week was in Chicago attending the Alzheimer's Association where they had all the scientists from around the world come in to talk about what's going on with Alzheimer's research. I didn't understand a word they were saying because it's a language in their own, but it was so inspiring to see how far they are coming in terms of not only a cure, but prevention. And so it was very, very interesting. Let me just say that in the African American community, we're quite aware that if, we usually die of cardiac disease, diabetes, all of that, cancer. But if we survive all of that, we have a 50% higher chance of getting dementia or Alzheimer's, and nobody knows why. And there aren't enough clinical trials based on that. And so we're pushing to try to get more people, number one, involved in clinical trials, and we know the history of African Americans in clinical trials. But we're hoping that people are now becoming a little bit more sophisticated in that area, that they understand the importance of them contributing to that, and to get the awareness out. Because for a long, long time in many of our communities, it was just that grandma was getting a little cuckoo, or grandpa he'll be okay as long as he stays in the basement. And we didn't look at it, in a correct way, when there really are efforts to try to address the growing problem of dementia and Alzheimer's. And so we haven't had a chance to really talk about health disparities because we just don't have enough time. But I want you to know, I think we're all quite aware of the growing increase in all of our communities of dementia and Alzheimer's effects, and the major costs it is having on healthcare in this country. So.
And just to, if I may,
Yeah, please.
just to build on Karen's point, clinical trials, research is so critical. The reality is that the medicine we have today is the result of clinical trials that have been done. And if you look at the data, today, for example, and this is true across the board for all of us, the number of individuals who are participating in clinical trials is so tiny, so small. For Latinos, it's 7%. And our population is, 17%. So we're not well represented, and that's true for African Americans, Asian Pacific Islanders, LGBT, American Indians, and older adults and women. So what that means is that the medicine that we have available today is not taking into account our genetic, is not taking into account our own realities as far as zip code and social determinants of health, which are critical in terms of health outcomes. So I think just encouraging our communities to take part of research, and I know there's a history of lack of trust in participating in clinical research, which is real and it must be recognized. But unless we participate in research, our communities will not have medicine that is adequate for us. The medicine that we have today is developed possibly for men and not necessarily for us. So there is a program and a really excellent initiative that is sponsored actually out of NIH, and it's a precision medicine program. It's the All of Us program. They are reaching out to 1 million people to sign them up into this database, and it's important that we all participate because the database will be made available to researchers to address Alzheimer's, cancer, and other major conditions that impact our communities. And so we must enroll, we must participate, and it is safe, independent of what your status is. In whatever way, they will keep they will protect all of us. I've asked this question from the federal government at NIH. So it's great to see that they've taken the measures to protect the participants. So wanted to just...
Just wanted to quickly congratulate the Alzheimer's Association on really being a role model when it comes to cultural competence in the context of the LGBT community, LGBT people. And Sage and the Alzheimer's Association are getting ready to launch a report that looks at dementia among LGBT people. The particular challenge that we face is less about higher level of incidence and more about the fact that our caregiving networks are so thin because of social isolation and the things I was describing earlier, that when there is a dementia diagnosis, it's actually very difficult to navigate that. But the Alzheimer's Association has not only invested resources and partnered with SAGE in that report, but also for a good number of years has been building the cultural competence of its chapters around the country on LGBT issues, and should be commended.
And then also in AAPI communities, so the concern about Alzheimer, dementia, as well as caregivers should not be separated. I think this is a really big concern for us. So translating the language from dementia, Alzheimer to the Asian language are very not easy. So I learned, even I am one of the Asian group person, but I learned that some ethnic group, when they translate dementia or Alzheimer into their languages, I think it is saying like some mental problem things, so they are very concerned to translate the language itself. So I think when we are delivering not only the Alzheimer or dementia, but other services as well, we need to know how, we need to ask our community or the representatives from the ethnic group the best way to deliver the information to the community. I think we have to ask their advice. That is my suggestion.
Well, I appreciate the panelists coming in and sharing their expertise and their thoughts on this issue of cultural disparities and health disparities and cultural competencies. I appreciate that. But as Sandy read earlier today, 217% increase in minorities in our country. So really, that's just a call to action for all of us to prepare ourselves to be able to take care of this growing population. Whether it's we have cultural competent people in our organizations to be able to speak the language and know the culture so that we know how to provide services in a culturally respectful way to different ethnic groups, and that all of it's really a call to action for us to prepare ourselves for this big growth in the minority population. Well, I know I've learned a lot today, and I appreciate the panelists coming in and speaking with us today, and we hope that you go back to your communities and start thinking about how you implement this going forward. And I think when you go back to the N4A website, where we now have a page on where you can find training and a toolkit there for cultural diversity and how you bring that into your organization. So I'd encourage people to go back and do that again. So once again, I thank the panelists for coming and spending time with us this morning. Let's acknowledge them for the time they spent. Thank you. Thank you so much. And now we'll have Sandy come back to the stage. Sandy?
It's unfortunate that that's all the time we had for questions for this incredible panel, because I'm sure this is an important dialogue and one that needs to happen here at our organizations, but it also needs to happen back in your agencies when you go back home. In saying that, I hope that you take the discussions that we've had this morning, as well as the information that you've picked up at the n4a, the diversity track that we've had throughout the conference, and really take that information back home. And as Kathy says, we also have, and it will expand, a diversity site on our website that is filled with resources, and hopefully will be filled with more resources to help you do your jobs in a way that really is reflective of the growing diversity in the aging population you serve. I want to thank Kathy for her passion and leadership on this issue, and I can't thank Michael and Karen and Yanira and EJ enough. They came back to N4A. They were with us in Savannah, and this was such an important issue that we had in a hot topic session. We wanted to have them back here to speak to the entire conference about this important issue. So thank you so much for coming again to N4A. In continuing our work to address health disparities among older adults, as I mentioned earlier this morning, I'm excited to announce a new collaboration between N4A and the National Minority Quality Forum. The Minority National Quality Forum addresses the critical needs for strengthening national and local efforts to use evidence-based, data-driven initiatives to guide programs to eliminate the disproportionate burden of premature death and preventable illness for racial and ethnic minorities, and other special collaborations. Through N4A's new collaboration with the Forum, area agencies on aging and Title VI programs will be able to access data reports regarding instances of chronic illness and conditions, dementia, and other broader health status factors that are affecting your communities. So I'd like to welcome Gary Puckrin, the President and Chief Executive Officer of the National Minority Quality Forum, to the stage to discuss this exciting collaboration between the Forum and N4A. Gary?
Thank you, Sandy. I couldn't go very far without thanking Courtney Baldridge for the deep collaboration that we've had in working on this project. This actually started several years ago. N4A and the National Minority Quality Forum competed in a competition that was looking at innovations in healthcare, and we actually won the doggone thing, and it was Courtney that really helped drive that. And so what we're talking about this morning is really an outgrowth and further of that conversation. So what we're talking about is the N4A index. The world of medicine and healthcare is moving from analog medicine. I don't know, I'm old enough. I used to go to the doctor's office, and that's where all of our health records were, in those analog files. I have no idea how the doctor kept track of it. And they would have to do, if they wanted to find out patients that had diabetes in their practice, they'd have to thumb through all of those files and figure out what's going on. we've moved out of that world of analog medicine, and we're moving into the world of digital medicine. And so what's happening right now across the country is that all of our healthcare information is now being collected in digital format. And the difference between analog and digital is that digital is portable. It can move around the world. It can move around communities. And so that transfer is really opening up the world. We're also moving into the world of biometrics. Soon we're all going to be wearing some sort of device that's going to be, right now, if you think about it, if you have diabetes, you can wear a glucose monitor that's actually pulling the data up in the cloud on your blood glucose. There are monitors for people with chronic heart failure. If you've got a Fitbit, it's telling you about your sleep. We're going to have more and more of that. We're going to understand how our bodies function in real time. It's going to be built into your house. You're going to have a smart home. All over the place, health information is going to be gathered. And the problem is that it's going to be part of that Internet of everything. I mean, it's just an explosion of information that I liken it to the feudal age, because everybody who's collecting data on you, every time you go to Google, you use your Apple phone, et cetera, somebody's collecting data on you. These feudal lords are holding on to it. They're not allowing it to move quickly and easily. And this is particularly important in healthcare because we have to learn about ourselves. And the best way to learn is in big numbers, is in crowdsourcing. And so we've got to get health information moving along. But the challenge is the data's got to be curated. You can't take all of that data from electronic health records, from biometric devices, from your home, wherever, what you're doing on the internet, and just put it out there. Your physician couldn't handle it. You wouldn't understand it. And so the frontier that's opening up is really about how do we curate that information, get it to the right place at the right moment so that we can provide quality care to each individual. And that's part of the work that our organization has been working on. And that's what I want to talk to you about this morning with n4a, curating information for the AAAs so that in community you actually know what's going on. So what I think about here is really some new language as we start thinking about the aging population. I think of the aging population as the vanguard. They are the vanguard. We are going to break through the ceiling in terms of how do we conserve life, how do we control health outcomes in community, and the way we're going to break through those barriers is through collaboration and using big data and big data analytics. And so what we're trying to do here is to begin to set the platform for you by giving you some information. So we're taking n4a and we're taking you up to the cloud. We're actually going to have you on the Amazon cloud, and you'll be able to go in and look at all kinds of information that you haven't had before. You'll know how many Medicare and Medicaid beneficiaries live in your community. You'll know how many of them have diabetes. You'll know how many of them went to the hospital. What did they go to the hospital for? What medications did they have? Did they follow the discharge plan? Who were the physicians that they were working with? Who's the health plan that's covering their lives in the community? How can I take that data that I'm learning and give it to my congressman, to my state representative, so that they understand the resources that are needed in community to serve the population that I'm treating? What are the hotspots out there? What are those zip codes where we see high levels of readmissions for diabetes or chronic heart failure or atrial fibrillation? When you look at the data, what you quickly realize, and I certainly realized, there are no random hospitalizations. You can look at a zip code and actually predict the number of cardiovascular events that are going to happen in the community within 12 months. You can predict how many people are going to be diagnosed with Alzheimer's disease. You can predict how many people are going to go on dialysis. if you go to a health plan, that's exactly what they're doing right now, because they've got to measure their risk in order to be able to control their business. And all we're doing is taking that information and putting it out at the population level, at the community level, so that you have access to it and so that you can drive change in your community. So that's sort of a representation of what it is we want to try to get your hands in, and also to position you in that Internet of everything. So here, what we anticipate is that we're going to have autonomous cars and transportation vehicles. And so when you come to provide transportation services for the clients that you serve, how do you do that in this new mobile world of technology? How do we tie you into that? And the way to think about it is, you want to become part of the switchboard on that Internet of everything, so that you are providing the services, but those who are actually, you're connecting to those who provide the services like transportation, but they're coming through you, so that you're collecting the data, you're understanding how your community needs to use that data. That becomes a very, very important thing. And the other thing to realize as we begin to stand this thing up, and I want to say it'll take time, this is not going to grow overnight, this is something that has to be built over time, is that you want a platform where all of those folks out there that are building all those applications and mobile devices can build them off your platform. You want to open source it, because I go to a lot of these technology meetings and everybody's developed some app for everything. God knows how they all do it. But the point is, they're not linked into you at the point of care. And so if we set the platform up and we open it up so that these developers who are coming up with all of these wonderful applications, you'll be at the center of it. What's also important, we're moving into the world of artificial intelligence. I mean, it's here right now. When you Google something, you're talking to a machine. That machine is saying, oh, you're looking for this? Let me tell you where it is. Let me tell you who has it. Let me tell you how much they have. When you pick up your Apple phone and you play Candy Crush, the reason why you can play Candy Crush for free is because they're collecting data on you. You're in a database somewhere. And then they take that data and they manipulate it. The whole controversy that we're having right now in our political system is because we don't understand the virtual world. We don't understand how the virtual world plays in a democracy, right? And even more importantly, we have not used the virtual world to conserve life. We've not used it to transform our capabilities. In the world of computers, they talk about the singularity. And when they speak about the singularity, what they're really talking about is that at some point, machines become smarter than men and women, and they drive the world. That's where we're headed. And so part of what we want to do as we start to collect this data is to begin to use artificial intelligence on it. If you have enough data, you can begin to predict the future. And if you're not predicting the future, you're not doing anything. If you're in the 21st century and you can't say in the next 12 months, a patient that looks like this has a higher risk for going to the emergency room or having an inpatient stay or not taking their medications or is not following care coordination, you ain't doing anything. You're fundamentally not doing anything. You're doing palliative work, but the future is really about controlling those health outcomes. And for us, and the reason why we're so excited about working with n4a, we're like the statistician at the baseball game. We don't go down to the field and play baseball. You guys play baseball. And all we want to do, if you ever saw the movie Moneyball, all we want to do is help you by giving you the numbers, by giving you access to the data. And we'll do it in a way that, so you don't have to become a SAS expert, you don't have to read spreadsheets. We'll use data visualization. We'll use things that are comprehensible for you, and we'll map things. So that's the future. That's where we are now. We are embarking on a journey really to transform how we think about aging. I don't think about aging as if they're a lost cause. I think about them as the vanguard for the future. Every disease that we conquer, every hospitalization that we avoid, every emergency room visit that we control, everyone that we can keep off of dialysis, that's the future. That's the 21st century. That's what we can do. And that's what we're building ourselves to do. Thank you much.
I hope you're as excited as I am about the possibilities of that. I think our partnership with Gary will really create this n4a index of healthcare information that you can use. We have a few minutes for questions, so I know we have mic runners, and if anybody has a question for Gary or about the index, please let me know. I'm seeing, and I have to say, Kathy, you're right. You really can't see out here. Any questions? There we have one right there in the middle. I can see it. I can see a hand.
Thank you for all the amazing effort into this and the foresight. I'm wondering how fast we can get this and what the rollout is.
I knew that was going to be a question. Go ahead, Gary.
So we're going to start putting information up this month, in the month of August. There'll be some training that needs to happen. But even more importantly, we have to learn from you. And we've got a lot of data. So we've been collecting data on the American population since 1998. We have a database north of 5 billion patient records. Right now, we're looking at 100 million lives a year. So we can do a lot of different things, but we need to understand what's helpful to you. So there's going to be some dialogue and back and forth as we try to figure out what's helpful, and then we'll start to put things online for you to access.
Great, thank you. And Gary, do you just want to give them a little sense of the data that you have that you're working with every day?
Sure. So we've got a lot of different partners. We've had access to 100% of the Medicare and Medicaid files since 2000. So right there, that's about 60% of all the healthcare in the United States. We have had some partners in the commercial world, so we've had access to commercial data. We also use a lot of survey data in the same way that when you go online and you fill out a little questionnaire, a little form, it gives insights into who you are as an individual and what your needs are. So we're collecting that sort of survey information and adding that into the pot. So it's a great big pot that we're creating, and we're dumping a lot of information into it.
Great. Thank you so much, Gary. We're excited, and I hope that you're excited. And as Gary said, this is in development. So we'll be coming back to you to determine what are the key data points to start with. And as Gary said, too, also doing training so that we don't just give you data, but you have a real sense of how to use it. So with that, Gary, thank you so much. Once again, I'd like to thank our generous friends from Cigna Health Spring for their support of n4a and this morning's session. Everyone give them a round of applause again. But we're not done yet. As we wrap up another successful conference and start looking ahead for next year. One, I don't know how many of our Chicago friends are in the room, but if they are, give them a round of applause for being such wonderful hosts. So speaking of what's next, we'll be meeting together next year in the beautiful and lively city of New Orleans. To give us a flavor of the Big Easy, it's my pleasure to welcome Howard Rogers. It's been a long conference, you guys. I'm really sorry. Howard Rogers, my friend, the executive director of the New Orleans Council of Aging, to the stage. Howard.
Good morning, everyone. It's easy. I'm going to welcome you to Mr. Rogers' neighborhood. So, as you see on the tables, I brought a little taste of New Orleans with me. We got some Tabasco sauce. So I'm inviting you to come next year to New Orleans to have a hot time and spice it up. And while you're there, I hope that you get a chance to not only enjoy what's going to be going on with the n4a conference, but also to get a chance to go around and see the city and enjoy our lovely city. And before you come, there are a couple of things that I want you to know. Number one, I like for everybody to understand a little bit of the culture of New Orleans. So if you want to take a test, one thing I'd like for everybody to think about is how to spell Chapatulas. That is one of the streets not too far from where the hotel that you'll be staying. So if anybody asks you that, you can spell Chapatulas. You might even get a free cab ride. Who knows? The other thing is that in New Orleans, we have a saying, where everywhere else in the world you eat to live, we live to eat. So don't worry about your stomach. Don't worry about those calories. Just come on down and enjoy yourself. And who dat?
Howard, thank you. Thank you so much for introducing us to your incredible city. You know, this man knows everyone in New Orleans. And so he is already starting to work with us to ensure that next year's conference is going to be absolutely fabulous. I'm excited, and I hope you are too. But before we redirect our focus totally to the great experience we're going to have in New Orleans, as we look at the year that we've had, I want to take a few moments to recognize the leaders of our network who have retired and those who have passed away during the course of this year. And they're on the screen. All right. I'd also like to acknowledge the incredible, great work of the N4A board this year, and I'd like to ask all of the N4A board members to stand. These individuals have represented you so well, and I really want to thank them for all of their tireless efforts on behalf of N4A, but also in their representation of you. I'd particularly like to acknowledge 5 of our board members who are at the end of their terms and will be leaving the board after this meeting. Lisa James and Eva Jewell. Also, Aaron Bradley, who served as N4A's treasurer this year. Odile Brunetto, and who served as N4A secretary, and Joyce Thompson from Louisiana are also leaving the board. And unfortunately, those 3 individuals aren't with us. But Lisa and Eva, could you please come to the front to get your plaques, your board plaques? And Rebecca, could you help me? I truly want to thank these ladies and all of the board members who are rotating off for their wonderful work. Please give them another round of applause. Thank you. At the end of this meeting also marks the transition from our current N4A president and into our new N4A president. So I'd like to ask Kathy Bowles to return to the stage. Kathy, I want to thank you for your leadership and guidance as president. N4A has embarked on a number of new initiatives, and membership has continued to grow under your leadership. We have a small token of appreciation from the staff to you for being such an incredible N4A president.
Thank you.
She can't leave without her gavel.
Oh, I love it. You know I love that gavel. Oh, how beautiful.
Here you go. Ta-da!
Ooh. It is heavy.
So please say a few words.
Okay, thank you. Wow, sis, it's wonderful to be here, and thank you so much for acknowledging. This has just been a wonderful time. I've enjoyed the experience. I've enjoyed working with all of you, meeting new people all across the country as I had speaking engagements here, there, and everywhere on behalf of N4A, and I just love N4A. What about you? Well, it has truly been my pleasure and my honor and privilege to serve as your president, and I didn't take it lightly. I valued and understood the gravity of what I was to do as your president. And I hope I made you proud, and I hope I did things that you're pleased with. But I could come up with the ideas, because I do that all the time at my AAA, but it takes somebody to implement. It takes another person to implement what you think. And this woman here, Sandy Markwood, she takes what I think, my thoughts, and she puts it on paper and makes it happen. So give Sandy a big round of applause. It's kind of bittersweet. I'm trying to hold it together. I am. But I'll leave you with this one thing, just this one thing, and it's been said for a couple days now. Be bold. Be bold. With all you do, be bold. So that's my only thing I'll leave you with. And at this time, I would like to invite the newly elected president of the National Association of Area Agencies on Aging, Deborah Stonewalls. Deborah has been duly elected by, this is what I'm supposed to read to you, Deborah. Come on up here. Oh, here you go. Woohoo. Go, congratulations.
Thank you.
So happy for you. Deborah has been the duly elected by the area agencies on aging and the Title VI program organizations across the entire country. And in keeping with the bylaws and the tenets of N4A, do you, Deborah, agree to support the office of presidency to advance the mission of N4A on behalf of all of the older adults and people with disabilities?
I do.
And Deborah, you know how I love that gavel. And everybody on the board knows, well, she knows how to work that gavel. But it is my pleasure, really, to pass the gavel on to you. Please join me, stand to your feet, and give Deborah a round of applause and support. Next president, the president of N4A.
Well, thank you, everyone. And thank you, Kathy. You leave some really big shoes to fill. Have to say that. And I have sincerely appreciated your leadership, your vision, your guidance, and I will be calling on you for assistance. And thank you to N4A and the N4A staff. You know, I don't know if you guys know, but in Washington, D.C., one of the predominant things you hear is N4A stands out amongst all organizations as one of the leading advocate agencies for seniors. And you have an impeccable reputation. I hope I don't mess that up. I'll try to be good. And you know, by saying I do, I think we're actually married now for a couple of years. So it's going to be a fun time. I do just want to say a few things. We all know that caregivers, it's hard for us to get caregivers to admit they're caregivers, right? We try to tell them they're caregivers and they simply say, I'm just doing my job. It's the same with all of you. We need to all recognize that we are champions. We're too slow to recognize the important role we have of championship. We just are very humble and we just say, I'm just doing my job. I'm in my corner of my world doing my job. But in being bold and in continuing to move forward, we're embracing that role of championship, right? We are champions. And I'm proud to serve in this role. I want to do a great job. Hopefully I can follow you, Kathy, and make you proud. But we are champions, and we have a great organization that allows us to shine our light and be those champions for seniors. So as we're winding down, let's go away with boldness as champions, because we really are champions. And we're doing our jobs, but we are champions. So thank you very much for the opportunity to serve.
Thank you, Kathy, for your incredible, outstanding leadership. And Deb, thanks for stepping up to the plate And I know that you will be an amazing president as well. As we wind down this year's conference, if you could indulge me for a few minutes, we have, and we're taking seriously, the charge that you gave us to be bold. But I just also wanted to highlight to you the work that you all have done and allowed us to do over the course of the past year. And just to highlight the accomplishments, because sometimes, as Deb said, we just do our work and we never celebrate our successes. And collectively, we have had many successes this year. And I don't know whether we are all queued up, but I wanted to highlight some of them. First is in the area of public policy. And recognizing the important work that you've done, we've been up on Capitol Hill to be able to take the data that you've given us and also the stories that you've given us, and it's made a difference. And you've seen that in the increases we were able to get in Older Americans Act programs. I really want to recognize the great work of Autumn Campbell, our Director of Public Policy, our incredible Chief of Public Policy and External Affairs, Amy Gottwalds, our Public Policy Committee, but most importantly, each of you as advocates. As our panel this morning on diversity spoke to, we all have to be advocates talking about the importance of the work that you all do and the needs of the people you serve. And we did it, and we've got to continue to build on it, and we can only do that with your support. So let's keep our advocacy efforts up and going. Also, throughout this conference, you've heard about the importance of building partnerships with the healthcare community, and also the importance of diversifying our funding and to be able to do those contracts and to do them well. And I really want to acknowledge, we've acknowledged many of our funders and partners who are part of the Aging and Disability Business Institute and the work that we've collectively been able to do together. As I mentioned in one of the sessions, 41% of the survey respondents, the area agency survey respondents, said they were involved in contracts with healthcare. We need to keep those contracts going and keep those relationships going, and we're hoping through our partnership on the new Management Services Organization, we can also support the work of the Business Institute to do that. But in addition, we also recognize that there are other needs that you have and you face every single day, and transportation is one of them. We know from the Elder Care Locator that transportation is the #1 issue older adults call us for, looking for a ride, not a ride for next week. They need a ride for today, often to get to the doctor or to get to the pharmacy. So through the National Aging and Disability Transportation Center, which is a partnership with Easter Seals, we are seeding innovation in this field and also doing training through online courses. And in addition to that, we also have a grant through the Administration for Community Living on inclusive coordinated transportation. So we know this is an issue for you, and we're trying to respond. Additionally, as we look forward, I mentioned the Elder Care Locator. The 4 millionth caller to the Elder Care Locator happened this year. And again, the Elder Care Locator just helps to frame the calls that we then send to you. And what we've seen is what you've seen, that it's not only just more calls, but they're more complex calls as people's needs are growing and growing. But in looking at that, we've tried to develop also some new additional resources. The critical conversation fact sheets around medication management really is in response to the opioid epidemic. And then also, given all the disasters you faced this year, also developing a critical conversation piece around disaster preparedness as well. But also capacity building and data. We're so excited about our new partnership with the Minority Quality Forum, but also through the Area Agency on Aging and Title VI surveys we've been able to do to be able to collect data that shows the trends and new directions of this network, and to give that data to you so that you can use it for both your advocacy purposes, but also to develop grants and other initiatives back home. And also this year, focusing in on some special targets around rural issues and also housing and homelessness, which we've heard are critical concerns. And Yanira, you pointed that out in the Latino community. And also we've heard throughout this conference the important issue of social isolation. And the other side of social isolation is social engagement. And launching the Engaged National Resource Center on social isolation of older adults, or social engagement of older adults, through funding through ACL and with partnerships with Generations United, the National Center for Creative Aging, Osher Lifelong Learning, and also OATS. So more to come on that, but we'll be developing a national strategy on engaging older adults, and we need your help. But also the strategy is to help you increase the numbers of older adults who are engaged back in your own communities. And also Dementia Friendly America, thank you so much from the Alzheimer's Association for your question to the panel. And Karen, like Karen, I had the privilege of being at the Alzheimer's conference in Chicago earlier the week before our conference started. And at that conference, participated on some panels with researchers who were doing amazing, amazing work. But so many of them came up to me and said, I am so glad for the work that your network is doing, because we still are a ways, and for some maybe a longer ways, to a cure. And we need to ensure that people who are living with Alzheimer's and dementia are supported at the community level. Your members do that, and Dementia Friendly America ensures that our communities support them as well. Additionally, we've developed a lot of publications for you, both our annual report, our public policy priorities, the elder care locator priorities. But the other thing that we're doing is, when we develop consumer-based publications, is allowing a space, incorporating in our design a space for you to co-brand them, because we recognize that you may not have communication departments, and we want to ensure that this information gets out to your consumers from you. And so that is our goal as we move forward with the development of publications. And in saying that, as n4a moves forward, doing it in a financially sound way is truly, truly important. And as you look at this, our financial sheet, which was in your annual report, please note, many of you in the room know this, but I just also want to note, when you see that change in net assets, what that means is that was largely the Hartford grant or other foundation grants that we get that we need to recognize in the year we get them, and then we need to spend the money over the course of the grant period. So we are in fine financial shape, and we really take seriously being your national organization. We are looking forward to working with you to be bold on the new initiatives we've announced here, the initiatives that we continue to operate on your behalf, but we couldn't do this without you. The work that you do back home, the work that you do every day to ensure that older adults, people with disabilities, and their caregivers are supported in the community and can live there successfully as long as possible. Thank you for your support of n4a. Thank you so much for being at this conference. I look forward to seeing you, as Howard does, in New Orleans next year. Have a great day. Safe travels home. Take care.